Home is where the art is. Examining home health referral practices in the Florida State University Internal Medicine Residency Clinic. Authors are Carolina Pudlova, Eduardo Serrano, Nikisha Rogers, Philip Gaillard, Marissa Ciesla, Claudia Crocker-Body from Florida State University. My name is Dr. Carolina Pudlova, and I come from the Czech Republic, a small country in the heart of Europe. In my native language, home is called domov, and it describes a safe place where people are comfortable, surrounded by their loved ones. Medicine is more than a science. Have you ever wondered why is it also called an art? It calls for creativity and innovation to give our patients the best outcomes and enrich their quality of life. One such patient population where quality of life is key is the geriatric population. Per CDC, during 2014 to 2017, 20% of all emergency department visits in the United States were made by patients aged 60 years old and over. The Florida State University Residency Program cares for geriatric patients. Some of these patients are at high risk for hospitalization because they have unrecognized geriatric syndromes like falls. During the throes of the COVID-19 global pandemic, we realized that our geriatric patients were even more vulnerable. Our study was designed to see how the FSU Internal Medicine Residency Clinic could partner with home health agencies to address issues that could perhaps avoid the perils of an unnecessary emergency room visit or hospitalization. Why is this important, you may ask? Because hospitals and emergency rooms are dangerous environments for seniors. Elderly patients are prone to developing geriatric syndromes during hospital stays. These include deconditioning and hospital-acquired infections. We must therefore develop the art of thinking creatively to care for our elderly patients at home, also because care is costly. Background. By 2060, 1 in 4 Americans will be 65 years old or older. Coordination of complex geriatric patient care is a self-perceived deficiency of many internal medicine residents. This study evaluates clinician expertise in initiating home health services in at-risk clinic patients in our own Florida State University Internal Medicine Residency. Method. Chart review of the entire clinic population was done from January to December 2020. Fisher's exact test evaluated if referral practice was associated with the clinician's training level. Results. 459 geriatric patients were identified during the time. 58 were later seen either at our emergency room or were admitted. 72% were female and 28% were male patients. African American and Caucasian patients were equally distributed. Heart disease and falls were top hospital diagnoses. 43 had preventative home health referrals. Only 15% of these patients had follow-up, which means that physician was aware of status and results of the referral. Attendings were most likely to request referrals and chart follow-up. This was statistically insignificant. Discussion. Our study showed that we need to improve on identifying vulnerable geriatric patients in our clinic. To help us achieve this goal, we need to include geriatric-centered curriculum during residency training to help us properly identify vulnerable patients and utilize timely home health referrals to avoid unnecessary hospitalizations and their associated risks. Our study reinforces that even during a pandemic, we must not forget to consider preventative home health referrals in seniors with cardiovascular comorbidities and history of falls. Collaborating closely with home health agencies can help us improve our ACGME competencies, particularly system-based learning and patient care, so that home or domov can truly be a place where the art of medicine can thrive once again. Our references are listed below. Thank you.